Hello friends, welcome to this lecture. The Tuskegee Syphilis Experiment. This was the longest standing trial which lasted 40 years and where's no place other than the United States, which is the father of clinical research and bioethics. How could this be? Let's see what happened. So in 1932, the trial was initiated. There were 399 infected men and then another 201 subjects without syphilis. And what were the key features? There was no consent. And then these men were told they were treated with bad blood, and they believed that. And then because the subjects can go to their local physician, right? So even the local physicians were told not to treat the subjects in 1936 for the sake of the trial. So it was always about the trial, and the subjects were not given second place, not even second place, they were not given any place at all. And then in 1940, some of the subjects were drafted to the military, and in the military, subjects are screened for venereal diseases or STDs, and they're treated if they have anything. And some people in this trial pull some strings, and even the military were told not to treat the subjects who were drafted to the military. How bad. And in 1945, the miracle drug penicillin was discovered and believed to be an effective treatment for syphilis. 1947, rapid treatment centers were formed throughout the United States to treat subjects with syphilis. But the subjects in the trial, they were withheld. They were intentionally withheld from this rapid treatment center. This went for like another 20 years, like 2 decades. How bad it is, right? US Public Health Service employee Peter Buxton came across this horrible study, and he couldn't take it any longer. He blew the whistle, right? He was a brave young man. He decided to face all the powerful forces and blow the whistle. But what happened? Nobody listened to him. The Center for Disease Control, they rationalized and justified this trial, and they decided it must go on because the trial is so important. And even the American Medical Association agreed with the CDC. And then the trial went on. But then Peter Buxton couldn't take it any longer. He felt this horrible injustice. What did he do? He went to the media. He went to New York Times. New York Times, they published this article. Syphilis subjects went untreated for 40 years. It was in the first page, a very important article. There was a huge public outcry, and the government was pressurized into terminating the study. So that's good, right? So what was the aftermath? 28 had died of syphilis, and 100 have died of related complications. 40 of their wives have been infected, and 19 of their children have been infected. So what did the children do? When they were born, they never consented to this study because of this lack of ethics. They were infected too. It's horrible. And then there was a class action lawsuit against the United States. The government paid a whopping $10 million at the time to the victims and their families, and another $49.6 million in 2017. Public health benefits scheme was sent specially for Tuskegee victims and their families to provide free health care to the surviving victims and their family. And as reconciliation, public body to address bioethics was set up. National Commission for the Protection of Subjects of Biomedical Research and Behavioral Research. This was the first of its kind which was set up. So as horrible as this 40-year trial was, gave birth to this Institute for Bioethics. In 1997, President Bill Clinton, he made this beautiful apology to the surviving victims who were at the White House. He said he looked directly into their eyes. He said, we can look directly into your eyes, and on behalf of the American people, we can say, sorry, what the United States government did was wrong and shameful, and I'm sorry. What did we learn from this incident? We learned that these horrible incidences did happen, but we need to learn from it. We need to help the victims and their families, and then move forward. All the stakeholders together discuss and see what went wrong and how do we prevent this in the future. A huge respect for bioethics, and my heart goes to the victims and their families. I hope in memory of them we don't do this sort of thing again, and that's where as a clinical research associate, me and you come in. We help to protect the subjects and help to conduct effective clinical trial. Hope you learned a bit from this lecture. So read up about the Tuskegee experiment. It is very interesting, and hope to see you in the next lecture. Ciao.